Hi, I'm Dr. Fischelberg. Today we're going to talk a little bit about sprains. When I think of musculoskeletal injuries that we see the most, we see strains, sprains, and fractures. So strains typically refers to muscle strain. Sprains refers to the injury or the stretching of the ligaments that connect your bones to your bones, and fractures, of course, mean injury to the bone itself. So sprains are probably the things we see the most, and the ankle sprain is the classic example. We've all twisted our ankle before, rolled your ankle before. What's happening is those ligaments that connect your ankle bones to your foot bones get stretched and injured. The most common symptoms you'll see are swelling, pain, and the inability or the refusal to bear weight or walk. Those are signs that you've probably sprained your ankle. Now, in order to treat your ankle sprain, the best thing to do would be use an anti-inflammatory pain reliever like Motrin and also RICE, R-I-C-E. R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. So the rest is the most important part. Orthopedic surgeon that I trained under many years ago taught me that the number one risk factor for ankle injury is previous ankle injury, which means unless the skateboarder, basketball player, ice skater, gymnast really rests their ankle adequately and heals the sprain and those ligaments can kind of return to normal, you're at high risk to have recurrent ankle injury or chronic ankle problems. So rest is number one. I is for ice. The first 48 hours after a musculoskeletal injury is crucial. Ice causes vasoconstriction, decreases swelling, decreases pain. So ice is super important in the first 48 hours. C stands for compression. You get an ACE bandage or one of those sleeves to really compress the joint, minimize swelling. And E stands for elevation. Lay on the couch, prop the ankle up, get that ankle above the level of the heart, decreases blood flow, decreases swelling. So Motrin and RICE are really the hallmarks of the early phases of treating an ankle sprain. If you're unsure, call our office. Our nurses are on hand. Our talented nurses are going to help you figure out if your child needs to be seen or not. And we're always here. We're happy to examine your child and help you decide what to do. The most important thing for us to think about is, are we missing a fracture, or who's at risk to having fractured their ankle? So number one, if you feel like the symptoms are progressing, they're persistent, or they're worsening, that's worrisome. Or number two, if there's point tenderness on the bony bones of your ankle, there's three places to look for. That medial malleolus, that pointy ankle bone on the inside, that lateral malleolus, that pointy bone on the outside of your ankle, or along your fifth metatarsal bone. That's that bone on the side of your foot that connects the pinky toe towards your heel. Those three spots, if there's real exquisite point tenderness there, the fear of maybe a hairline fracture or a stress fracture is higher. So when in doubt, call our talented nurses. They'll help you talk through your symptoms. Come and see us. We'll help you decide if you need an x-ray or not. But first step is get some Motrin and start doing your RICE. And that's how we attack the common ankle sprain.